Welcome to the Understanding Patient and Client Partnerships in the team context. As we thought about this particular learning activity and thought about how important it is for us to acknowledge the partnerships that we have with our patients and our clients, I thought it made most sense for you to hear and to learn a little bit more about the concept from somebody who has actually experienced the healthcare system. I'm going to introduce you to Janet, and I have given her 3 questions to consider. One is just to provide some context as to what her own experience is so that you can get to know her a little bit. And secondly, to describe a bit more about her understanding of patient and client partnerships, particularly in relationship to the healthcare system or social care system. And finally, to talk a little bit about an example that didn't work as well, and it gives you an opportunity to consider a little bit further. So I'm going to pass this over to Janet, and she's going to tell you a little bit about herself.
Thank you. Well, you've heard my name. I'm Janet Rodriguez. I'm a professional translator. When I was 29 years old, I was planning my life, doing a master's degree, having children, doing my business, travel. But suddenly arthritis came into my life. And rheumatoid arthritis is a chronic illness that not only affects your body, but literally takes over your life. Arthritis has no cure. In fact, arthritis brings new diagnoses. Graves' disease, anemia, insomnia, anxiety. And for all of these, there's even more the medications for all of these other new symptoms brings more problems. Constipation, high blood pressure, depression. Whenever I reported a symptom, I was given medication, therapy, treatment to make that better. But it really did not address everything that was happening in my life. I'm going to give you an example. My doctor knew exactly which joints in my hands were not working. And he would give me medication for this, and the medication worked. However, my hands are not working. I cannot clean my teeth. How can I do this? And how can I have that conversation about teeth with a rheumatologist? It doesn't fit. I happened to go to this joint effort lecture from the Arthritis Society, and I literally realized that I needed to be a partner in my healthcare. When I face a problem like this, I talked to my dentist. She told me, how about a toothbrush? I asked my doctor for a prescription. I was able to have coverage for it. I'll give you another example. Arthritis makes my knees and my ankles really swollen, and I'm in constant pain. The doctor gave me medication for this, and it worked. However, I was terrified of going to the washroom. Every time I sat down or stood up, the pain was excruciating. Once, I literally ended up in the hospital with a disc herniation just from trying to stand up from the toilet. Luckily, an occupational therapist introduced me to the wonderful world of raised toilet seats, grab bars, and other gadgets that literally helped me do buttons, put my shoes on. I was able to do a lot of things with a lot less pain. So yes, arthritis takes bits and pieces of your life. Each healthcare provider in my care was actually taking care of my knee or my head or one part of my body. But I am much more than just bit and pieces. I'm a whole person. So when I understood that I needed to be part of this healthcare team, things really started to work better. A lot of the things that were not working in my body still don't work, but I can do a lot more things. I can plan about my life. one thing that was not necessarily working, and I even didn't know about this, is I received amazing health care for my body, but there was a disconnection about my money. While I was getting relief from the pain for the swollen joints, I had to, every day, I had to face my future, where all the plans that I had, master's degree, children, a job, nothing. Those are not things that Tylenol can make better. Those are things that arthritis has brought into my life. I felt arthritis is taking control of my life. Yes, the pains are controlled, but what about my life, my future? I had hundreds of visits to different healthcare providers, but nobody ever asked me, how are you feeling? How are you coping with your future of life? Luckily, what I had learned from being a partner in my healthcare, I also was able to use it again when I received a diagnosis of depression. So now I was able to, again, be part of that managing of my healthcare. I do have a chronic condition. That doesn't mean that I'm ill all the time. I'm not sick all the time. I have to do a lot of living in between visits, and things such as being able to take care of myself really helps. Having a life that is much productive and with a lot less pain.